very, 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 very well-known injector. So I'm very humbled that he is here watching me now doing the trainings. Alrighty, so your name is? Carolina. Again, Carolina. So much Carolinas here. So Carolina, and again, I'm going to show you, it's not going to be like a holistic approach for this one, because Carolina has, you see, a retracted chin. We're fine on the screen? We're fine on the screen? Everybody can see. So Carolina has, as you can see, some retraction to her skin, to her chin. This is where I'm going to be focusing most of my work. She has, as discussed in the first patient, thick skin. She ages with gravity pull. So for us to do the lifting, we're going to need more modalities like threads or any kind of radiofrequency lasers. For her, I'm going to do a treatment for the under eyes with the eye booster. Those of you who were with me during the break, they had the feel of the under eye booster, which is very, very, very thin. So this is my ligament, and this is my area on the injection, a radial triangle where I'm going to inject my eye booster. See, this is the vector we are looking to lift. I can do just a bolus injection in the maximum area of projection. It will give her some little bit of lifting, but don't do more than this, otherwise she will have widening to her face. We can do a tiny bit for the marionette, a little bit of lifting, but don't do more than this, otherwise she will have widening to her face. We can do a tiny bit for the marionette. The most area that we're going to focus on is the chin, a little bit the lateral jawline. Which product? Eye booster. Which product for a bolus to give a nice lift? L. And one piece of advice, when you use the L, use with it the 25 product, but it really gives a good result. Same thing also we can use for the marionette, and for the jawline, we're going to use, as usual, cannula with XL. Any questions or any suggestions? Okay, so let's start. Okay, sleep. Okay, so first we will start with the under eyes. So you have the eye booster. Okay, this is the entry point. Come here, please. So let's start with the entry point for the eye booster. I go deep to the level of the bone. Again, I take the track of the ligament because this will help me elevate the entire tissue. Just a tiny drop. 1, 2, 3, 4. And I'm done. That's it. So this is for the eye booster. Now, when it comes to the direct injection L, as I said, the maximum point of lifting, direct injection, give the patient a bolus. And I want to show you the direct lifting that she got. Can you sit up, please? And when she sits up, you can see that I still have here volume loss and the deep fat. Relax. So we will inject that also with direct injection with Infini L. There you go. Sit up. Now you can see the difference between the two sides when it comes to the nasolabial folds. Little bit of lifting to the vector. One more area that I need to inject is the lateral cheeks. This is done. Why am I doing this? Why am I sitting patient up and sitting her down? Because I don't want her to have volume. She has a round face. She has good amount of volume. She has already good fat in her face. We don't want her to have more fat or a rounder face. Remember, we need to achieve the heart shape. Now, if you sit up, please, there you go. Okay, this is L, and a tiny few drops of eye booster. You know my technique by now. I do injections with fillers, and then I end up with meso, because meso is going to hold everything into place. Next, we're going to do the jawline with cannula XL. Same technique. We have the jawline that is a little bit retracted. We're going to make it longer and more bulging. Can we remove the blood from that area? Can you stand there? 1, 2, and 3. So I'm injecting my XL. Injecting my XL. In the areas where the patient has lost her fat. So this is how she can get the perfect jawline. If you sit up, so you can see now, right? No marionette line prominent here. Here it's more prominent, right? the jawline is defined as compared to the other side. Here it's still prominent, and here it's all lifted. Right? We can still add some in the deep fat, some L direct injection deep fat of L, please. And we can add also XL in the marionette. Again, the same technique, same point of entry that I use for the lateral jawline. I will go and I fill up all this area before I do direct injection with L. L is very good for the injection of the chin. One, two, and three. There you go. Remember your anatomy. This is perfectly safe. And you're done. I usually use a 22 gauge cannula by 70 because it's long and I can use it everywhere. Direct injection. The orange one, this one. Please, direct injection. Okay. Usually the L is very useful using it for direct injections. Now comes the big one. She needs, of course, Botox because we have to relax the muscle. Relax. See, when she's tightening all the time. So you can start with fillers and then you can do Botox, not in the same session. We are going to try to make her chin longer and more protruded. I need more L, more L, direct injection. Direct injection. I can the cannula. It's fine.
Yeah.
Yeah. I need the point of entry point. So again, 1, 2, and 3. We're going to fill up the entire area. And there you go. Turn your face to the side. So here we're going to be supporting more the marionette and pushing the chin forward. I put my finger, make sure my product doesn't go anywhere. She will feel some pressure, correct? That the candidates we worked half face. We have to do everything because I want to show you how the chin is going to push. Sit up, please. Relax. Now you see the difference with a face that is lifted and the face that is still down. So the first candidate, she had a thick skin and she had good volume, but she had also loss of elasticity in her skin. The second patient has a very thin skin and she was a little bit skinny, so she had more loss of volume. Third patient has a round face, retracted chin. Most of the patients you see in the clinic, if they are young, then they don't need much treatments. This is where the job of the meso comes into play. We have mixed here aqua booster with amber, with collagen. How old are you?
40.
40.
Today.
Ah. Happy birthday to you. Happy birthday to you. Happy birthday to Carolyn. Happy birthday to you. Blow the candle. Blow. Again. So let's do now the meso. So you remember the first patient, we did for her the 5-point injections, then the superficial ones. The second one, we didn't do for her the 5-point injections because she will not benefit. She has a very thin skin. For her, she will benefit, okay? Because she has a thick skin and good volume. Again, 5 points, 1 centimeter underneath the lateral canthus, medial to the tragus, and the jawline, submental area, and lateral to the nasal ridge. So 1, 2, 3. Watch now what's going to happen with meso. I know it doesn't last, but I always keep telling doctors that they can use it for therapeutic reasons. So over time, patients will get good results. And blood, 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 blood. There you go. Give me the other one, please. You see the effect of the meso. Okay, I need you to stand there. Turn your face to the side. And now the final touches. Under eyes, lateral cheek, lower cheek, contouring of the cheek, contouring of the jawline. You remember the technique that I used for the other patient that had wrinkly skin? I don't use it here. Open, open, and she's done. I think that's it. Happy birthday. I just gave you a bruise on your birthday. There's your mirror. You can have it. Okay. And how do you feel? Can I have you I'm gonna let her sit up, and we're gonna see right versus left. And done, I'm gonna continue your face. No, can you sleep back?
Okay.
Birthday girl. I told you I do a lot of threads in my practice, and it's very difficult to give a patient that has good volume the result of the threads without giving them a wider looking face. This product is good because combined with the meso, it helps me achieve that. Can you sit up? And we're done. Good. Nice. Thank you. Merci. Next is, now we're going to have 2 older candidates, and I'll tell you what we can do with them. All right. Any questions? Yes? Usually, let's say Aqua Booster. Aqua Booster comes in 1 ml. It's a box that has 2 syringes. 1 ml. I use 1 ml for the patient. Put it in 3 ml syringe. Okay, so it's 1 ml Aqua Booster. Then I take 1.5 of any other 2 ingredients, 1.5 DNA and 1.5, for example, amber, 1.5 NHA, 1.5 collagen. So in total, I have 4 ml. 4 ml, as you saw, I used it where? I used it as 5 pence, and then I used it superficially everywhere. 4 ml on each side, so that's 8 ml. The vial comes in 10 ml. Yes, Paulina? The vial comes in 10 ml, so you take only 1.5. So imagine how many patients you're going to do. Now, here. So when a patient comes to you and they need sometimes more work, more than fillers, more than threads, more than maybe surgery, and if you want to give them a boost, the meso is perfect in this case. So what are we going to use here? Doris, correct? Are you Doris? Doris? Okay. Amber under okay, for Doris, I'm gonna use now the combination of under eye with amber. Okay, so under eye at the level of the bone, which is the eye booster, and the amber. This is for her eyes. For the smoker lines, I'm gonna use the S filler of Infini, and I'm gonna do it with a cannula. Okay, here we're gonna go superficial. Remember the arteries. For the lateral jawline, I will use the XL. When do I use the XL? When do I use the L? You saw the L is when you want to give really good definition, good volume. You just put the needle there and right away you have the lid and it holds. You cannot do much in the jawline if the patient has already good volume. Okay, otherwise she will look wider. The XL, it's smoother. It will give lifting, but it is smoother. And for the full face, we're going to finish by mixing meso L, wait, NHA and DNA. This is L, DNA, and I need NHA. Here, no. Meso L, NHA, and DNA. Maybe, what is this? It's here. You have L, you have DNA. I need NHA. How much I'm going to withdraw from these? I would say, because, again, thick skin, good. Volume, what do you do? Two techniques, 5 points, and then everywhere on the face. Okay? So since I'm gonna do her full face now, we're gonna do probably on each side 6 ml, 6 ml. So 2 ml of DNA, 2 ml of L, and 2 ml of NHA. 2, 2, 2. Okay? On each side. So I need 12 ml. So 2, 2, 2. Prepare them.
3 syringes.
You can, yeah.
About
And
mixing.
yeah.
About
Mixing, yes, of
Mix,
course.
mix.
Yes, yes, we'll always mix. Okay? 2, 2, 2. So, or you could do 3, 3, 3. 1, 1, 1, 1, 1, 1, 1, 1, 3 syringes. Okay, so you get the way you withdraw is with the 18 gauge needle. It's easier. This is the 18 gauge. Withdraw 1, 1, 1, 1, 1, 1. Okay. One, like I said, I will start with the under eye booster. I always use a cannula for the under eye. Not sure what you do in your practice, but cannula is the safest approach. So sit up, please, Doris. So, like I said, so for Doris, we are going to be treating her under eyes. What's different in Doris that we didn't have in the other patients with regards to the under eye? Who can help me with this? Why should I be more careful with this compared to the other three patients that you saw? Why? In the under eye. She has what we call fistones. And these fistones, they come from what? Hormonal issues, smoking, water retention for any reason. We never inject these, okay? And this is the ligament that is pulling down. So I have to focus on injecting that one. Plus she has volume loss here. If I put for her fillers, she will have worsening of her under eye. We don't put fillers for Doris. So we're gonna do the eye booster here under eye. You can use the Infini S, okay? You can use the Infini S under eyes. It will give a nice result. This is a no-go zone for us. This is my area of injection. Yes, the collection, the triangular collection of the water retention. We call it fistones. What I do in my practice, I'm going to give you a trick. You're going to thank me for this later. You melt it down with high ice. You can melt it, it goes away completely with high ice. Sometimes it needs a couple of sessions. Sometimes it needs 2 sessions, but it goes away, okay? But don't put too much. Put like 0.2 or 0.3 maximum. Massage it, send the patient home, she comes back, there's nothing. Then you can do your injection, all right? Now, so this is my vector, thick skin, good volume. She's a candidate for a little bit of fillers, not too much, but more thread lifting. So I need to lift this using fillers. Any suggestions? What would I use for this patient? We set threads. If I want to use for her fillers, I would use under eye booster, or Infini S, which is the small filler. Then I would do for her some lifting. I would use the L, Infini L, direct injection. Direct injection. Yes, but here. What did you mix here?
Yes.
What do you have here?
This and this.
I want all 3.
Yeah, I know.
Okay. So no need to mix because
But I have prepared one already.
where?
Here it is.
Okay. So can
So
you
it's
mix?
the second.
Yes. Second, and I need one more with 1/3. Okay. So we will start as usual with the under eyes. Would you like me to inject Infini S under eye? Do you want to see the results? Okay. Let's have the Infini S under eye. because you've seen the eye booster already. All right, you can relax. Lay back, Doris. Just sleep. And cannula. 1, 2, one more.
Make it 5 because I prefer.
No. Draw 1, 1, 1.
Yeah, but can I make it in this range?
Yeah, no problem. Why? Because you don't
Oh, no.
have. Yeah,
I will
yeah,
manage.
You don't
I'm
have to
just
open you.
stressed.
You don't have to open you. I know you're stressed. Relax. Deep breath. It's fun to be on stage. خلاص. By the way, I'm done. That's it. I'm done.
Yeah,
I'm
okay.
done. Thank you. Give me. Which one is the third one? This L? Okay, that's it. And close this, please. And put yellow head. Right. Now, I need you to help me. Give me the S with a cannula. Ready? Ready? Okay. So I will start by doing for you injection under eye. 1, 2, and 3. This is my entry point. This is my S. Remove the entry point, please. Take this. Okay. 1, 2, and 3. Again, I'm deep. I go under eyes. You have to be very careful in her case. Just inject at the level of the bone. I always put my finger here so that the product might get. I feel the cannula. I made a lot of videos with me being blindfolded. I like to do under eyes and brag about the fact that that's it. Sit up. That's it. You like it? It's nice. So not only she had improvement of her under eyes, but she also had improvement in her cheeks as well, right? Go back. This is nice. Now, I need to use for her direct injection L. Close this one and give me direct injection with L. What is direct injection L?
You took it already.
Infini L. This
Just bring it
is,
to you.
yeah, can you bring me L? I will put, don't, relax. I will put a tiny bit more of under IS. And one more trick. I'm injecting in front of the stone, and I'm going to inject behind it. This is my thin stone. I'm going to inject, on top of it, near to the bone. Again, I'm going to go back. S. We are still working with S. We are not working with the eye booster because you want to see the S. And there you go. Much nicer. Thank you. It's here. So show you guys. Now, see this ligament? It's prominent. I haven't injected that one. We're going to do direct injection. Go back, please. 1, 2, and 3. This is 0.2 ml. Again, 1, 2, 3. Another 0.2. The nice thing, the take-home message I want you to know is L, 25 gauge cannula, 25 gauge needle, direct injection gives you instant lift, not given by any other. Honestly, there will be no what? Excuse me? Swelling? Just minor swelling. Minor swelling. This is the maximum swelling that she has. And I continue my contour, direct injection. Even if the patient gets swelling, you know, I had this question asked a lot during the break. They get, they don't like it, right? Different countries, different approaches. So, sit up, please. You can see how the nasolabial fold is completely lifted. The other side is down. Again, I repeat myself, this is a difficult candidate to treat with fillers and to give her this result because she has big skin, good volume. Now, I can do a little bit in the jawline, but not very much keen on that because it will not change much. Okay? It will change very little. And I don't like to put fillers without needing those fillers. But I will do a little bit in the marionette. So I need direct injection, also L. Bravo. You're doing fantastic. So you're doing great. 2 and 3. So for us to get rid of the marionette, I would advise to do 3 procedures together, not at the same time. Let's say I started with fillers. Next time you tell her to come and you do some Botox. And then next time she comes, you do a thread. 1, 2, 3. How do I know where I need to inject? So something was supporting the skin before, which is the fat, and the fat is gone. So this is what I inject. And I do not inject too much in the fold itself. Otherwise, it gets worse. And as you can see, we always inject the chin. I go very deep. It will help me, you know, in the time. Yeah. Can you sit up again? I'm so sorry. See, the jawline, I gave her a jawline. Now, after I did the chin and the lateral chin, she might benefit from a tiny drop over here. This is L. Yes. This is going to be your favorite product in the clinic, along with the amber and the eye. There you go. So this is the L. You see? You can tell how one side is lifted and one side is down. We finish off with our mixture, which is what? Infini, Meso L, NHA, and DNA. Again, thick skin, good volume. What do? 2 techniques. Which one? 5 points and superficial. Sleep out. All right. 5 points. Do you want me to draw the 5 points again? I will draw them. Thank you. Alrighty. So this is 1. This is 2. This is 3. This is 4. And this is 5. Yeah. Actually, this is where you have the ligaments. So when you are injecting behind the ligament, you give the lift. That's the whole point. They coded 5 points for the purpose of marketing. 2, 3, 4, and 5. Now that I'm done with the 5-point injections, I'm going to finish off with lifting technique. I always do from the lower cheek, okay? As if I'm drawing now. Filling my knees. Lateral lateral jawline and a tiny drop under eye because I have to. Okay. That's it. If you see an ointment jet, please. Whenever you get a tiny bruise, you just press very hard, and I need the wipe with alcohol. You can press. And Fusidin, the cream. After we finish, I'm gonna do your face later, the other side. you think she needs treatments for the smoker lines? Not anymore. Right? Everything is lifted. Can you sit up? And there you go. Face completely lit, completely. Okay? So she can what you can do for later, what you can do, you don't have to do all this, but at least you can start with the fillers. Then to make a big impression on the patient, do the mixture of the meso and then tell her that if you want to maintain with this treatment, come back and do 4 treatments within 3 weeks. And it really doesn't cost too much in the clinic. And you can sell her a package and she can use it over the course of 4 weeks. And repeat it then after 2 months or 3 months.
Thank you so much.
My last candidate. Perfect. Perfect. Now, you can remove the numbing cream, please. The cream. Cream and clean with them. Okay? So we will use the same combination, it's fine. We will use the same one. And then for her, can you please sit? Okay, come. No, stand up. Give me your hand. Come here. Come to me. And from the middle. Yes. For the Aqua Booster Amber DNA, Lips M. Only Aqua Booster. Anybody? 1 second. So for the last patient, because we cannot do much with fillers, she needs more advanced treatments. I'm going to show you the effect of fillers by themselves, okay? 5 points, and then superficial, then I'm going to do the smoker lines, then I'm going to do the lips. Does anyone want to do their lips? Anybody wants to do their lips? Yeah? Okay. Can you come? Can I see you? Yeah? Because for the patient, you're not going to see much difference. She has lots of volume, but like rejuvenation. So you already have fillers. You have? This is your lips?
Yeah.
MashaAllah. Wow. Where are you from? What's your name?
It's called Magna.
Magna. Okay, come to me, Magna. These are your natural lips. 0 fillers.
Zero everything.
Really?
Yeah.
You want me to do your full face? Okay. Okay, we will start with the lips.
Yeah.
So is the camera here? I need to show her lips. So for her lips, you know, I have something in my clinic that if a patient comes to me and she has old fillers that has migrated up or down, I don't do a single drop of fillers without melting down anything. I start from, I don't care if I have to melt down 1, 2, 3, 4 times. She has to melt down everything. Otherwise, 1 drop can ruin my work. So for smile, so we have, yes, some gingiva that is showing. So we're gonna do some fillers that are natural, and I'm going to change a little bit the shape of the lips so that this elevation goes down. So we're gonna flip the lips. Okay, lip flip. Okay, contour. This is painful. You need to get me the, yeah, can we put numbing cream for her? And you need to get me the lidocaine from my room. We're gonna hit you with lidocaine. Is that okay? Because it's painful.
Yeah, don't worry. I did this C-section. So.
Okay. Numbing cream for the lips. It's and the lidocaine is in the fridge.
Okay.
This is Paulina. You have to go to this room
Okay.
and you open the fridge.
Okay.
You find the lidocaine. Alrighty. Hi. You understand English? No? No? You can translate?
Yes.
Okay. So your name is, what's your name? Danuta. So for Danuta, can you sit up, please? Sit up.
وشلون جاباني؟
Okay, so I'm not going to do any fillers. I'm just gonna do boosters, and you're gonna see boosters for patients that have skin damage, how they're gonna benefit, and you tell the patients to do multiple. I'm going to do a little bit of around the lips and the smoker lines. Okay. So we're gonna use the. Merci. Direct injection. This one, please. So I will start with my mixture. Again, same story, thick skin, large amount of fat, 2 techniques, 5 points and entire face. 1, 2, first point. 1, 2, first point. 2, 3, 4, and 5. 5 points. This is same mixture, same thing that we used before, which is the aqua, the DNA, and the amber. Okay. All right. Can you sit up, please? How do you sit? Okay. So we did the booster only. You will see the best result when she is going to do the smoker lines. Relax. Okay. This is what M. Okay. This is going to be a little bit painful. So I'm gonna use a cannula for her. And we are going to be using the collagen C+, which is an injection, to take care of the smoker lines. Thank you. And give me the entry point, please. Alrighty. Can you give it to me? So, open. Open. Yes, thank you. 1, 2, 3. Sorry. Strong woman. Okay. Now, with a cannula, I do my section first. All right. Then I'm going to fill up the entire area with collagen. Again. There you go. This is if the patient doesn't want to have any fillers. Okay? Now, I'm going to show you when I put the fillers what happens. Give me the medium. Okay. Focal lines. They are quite deep, okay? So she will need multi treatments from the time, a big difference because it's very, very, very deep. Okay, sit up. Little bit of difference, little bit of lifting, but I had to show, every single type of patients that you can get in the clinic. It's collagen plus, C plus. Yes, and I used with it the medium as well. So I need the collagen C plus. Okay. Très bien. Again, 3 points, please. Sit. Smile. Relax. So, what would you do for a patient that comes to you and she has a lot of wrinkles? Would you do for her fillers? Would you do for her threads? Would you send her for surgery? Yes. So I'm gonna do the direct injection technique themselves. So we used M with cannula, then we used M direct injection, and we used the collagen C plus. I only did the upper lip. We will continue later with the other treatments. Can you sit up? It's not bad. No. It's not bad at all, right? But you will need multiple treatments, okay? I wanted to show you with really the skin what you can do. If we're using meso, if we're using fillers, it's a different case scenario. So this is a patient where I only used meso. Now I need to do full face. You okay? For her, we will inject the nasolabial folds. And the marionettes. Can I have the other one, please? Lateral jawline. Again, under eyes. Another needle. This is broken. Can I have...
Just 1 second.
yeah, that's the one. Thank you. So our recap. We did a mixture of aqua booster, DNA, and NHA. Okay. We did the 5-point injection, and now I'm doing the full face approach. One more thing that you can do for this patient. She comes, she tells you, I have an event. It's the wedding of my daughter, and I want to look really good. What would you do for her? Yes, yes, yes. What would you do for her? You do for her amber. Okay? So this is the amber. We use 1 ml syringe. I need 18 gauge. And I need the green head needle, please. Succinic acid is going to give her an instant lift. One, two, three. So just trying to show you without fillers, if you just want to do meso for a patient, for a quick fix, you okay? Yeah? Good? Okay. Happy? What, pain? Okay. Good? Okay, I need the cream, please. Cream.
Cream.
Yes. And it's done. I'm going to let her sit up and you will see. A patient like that, I would tell her to come to me every week for meso. Okay? What did we use? We used a combination of aqua with DNA with NHA. Okay? 2 ml, 2 ml, 2 ml. This is a total of 6 ml. Then I injected them at the 5 points. Then I injected them superficially. Right? I finished off with 1 ml of amber. Amber, always use it with a 32 gauge needle. Now sit up, please. No, no. Okay. And no. Stay like this. Okay. What do you think? Okay? It's good. It's not bad. Thank you. Merci. Thank you. We continue later. Yeah. You know what? I think I will continue your face by the time there is Or we can put for you numbing cream for the lips. You don't need it? I will. No.
I take care of my skin from very young age.
It's very nice. Very nice skin. So we just need to put the cream. This is our last candidate. If there's anything you want to add, there's anything you want to see, let me and we can find a victim for that to work on. Cream. No, the numbing cream. I think there's no need for the numbing cream. We just put anesthesia.
I can take it.
Okay. Give me. This is what?
This one or no?
Give me. This is what?
This one or no?
I would adrenaline. Very good. Okay. This is the one you use at the dentist. Okay. Do you have any allergies?
No.
Allergy to adrenaline?
No.
Have you been to the dentist? See your injections? Everything went fine, yeah?
Yeah.
Okay. So, let me use this one. Yellow. This one, look how I fill it up. Thanks. Okay. Again, another one, please. Put the yellow.
What's your opinion on my skin? Do you think I need a full face?
Okay, guys, tell me, what does she need? Mainly. What would you do for her? Let's say theoretically I want to do the full face. What would I use from the products of Infini? Let's start with the fillers. So if you use combination of L and XL, XL to do the contour like we were doing, cannula, and the L direct injection so that she gets the beautiful. For the jawline, also, once you use the cannula, use the XL. If you want to give her a bulging, you're going to give her the L direct injection. For the chin, she needs at least 3 to 4 ml of filler direct injection L, or also you can use the cannula. Don't do them all together because you will have like a lot of pain and pressure. So it's multiple sessions. Let's start with the anesthesia. Can you clean, please? Everything? Yeah. Spray. For this, I have to take her a little bit backwards. So you need to fix the camera, I think. Can you clean, please? No, only here. Doing the lips. Are you comfortable?
Yeah.
And this. Now I have a special technique for injecting the lips, but this is in other courses, special for the lips. So I will just do the regular one. Okay? 1. Are you ready? 1, 2, and 3. Bravo. Excellent. 1, 2, 3. Excellent. 1, 2, 3. You're good. Did you feel that? Bravo. And you're done. Thank you. Whenever you're ready, I'm ready. Meanwhile, anybody has any questions? You enjoyed the conference? Yeah? If you guys come to Dubai, let me know. I would love to see you again. Really. You have my Instagram, just text me. Nam?
In this area, in this, not that much.
Let me have more. Oh, sorry. Can I have a face mask, please? Down. Down. Good. Oh, I cannot put a face mask. Forget it. Forget. I forgot. So we're going to use the Infini M direct injection. You can get me one from there. M direct injection. I hope you don't burn. Alrighty. Can you come up as much as you can? You feel nothing, huh? No, come up. The entire body, like
Okay.
lift, sit up. No,
Step-
sit up.
Oh, sorry. You want me to sit?
Sit. Yeah. So your head here. Come closer to me here. Okay. Thank you. That's that. Yeah, this is good. It's fine. Just because when I do the lips, I let the patient sleep back all the way, and I do it by sitting on a chair. But it's fine. All righty. Let's start. Ready? I will start with the lower lip because it's less painful. I need, please, this one with alcohol. 1, 1, 2, and 3. So let's start. So we're doing the fillers in a way that she doesn't get any hardening of the lips. I did a little bit in the lower lip because she needs, because they're dry. Okay, just because they are dry.
I'm crying.
I know. And we only use here 0.3.
It's
Point one, point one,
voluntary, yeah.
Okay, just for you to have some plumping because it's dry. Now we're going. You can sit here and press on the blood. I need you to stay here and press on the blood. Yes. Now going doing here, and there you go. With one injection. Mm. 1, 2, 3. I'm so sorry. Beauty is pain. Okay, you can remove your hands. What do you think of the shape? It's not bad, huh? Now that we did the lip lift from outside, now I can start working on this part, right? Tap wherever you see blood, tap like this, okay? One trick that you can use at the clinic is cotton. So this is cotton. You just put on the blood. That's it. So that you can continue your work in peace. Okay?
Não, isto é involuntário, não está muito começas é involuntário. Yeah. It's
I need
it doesn't hurt. Yeah, it doesn't hurt that much. I'm crying.
I know.
Yeah, yeah.
Involuntary. I
Yeah.
understood. Yeah. Tears of joy.
It hurts, but not that much.
Yes.
Yeah.
Okay. You're scared, probably. A little
I
bit,
don't
no?
know. Yeah.
Ah.
Yeah.
Okay. Happiness.
Yeah.
Tears of joy. Okay. Now we're going to lift this part as well.
Yeah. This is almost nothing. Yeah.
And I need more cotton, please. Cotton pieces. And we're going also to lift this part as well. Then I'm going to do my trick. I know this was painful. Can you change the needle head, please? It's
the middle
soft.
hurts more.
It's soft. It's nice. She still needs on this side, and she'll be fine. This is the M. Okay. Nice volume. Nice volume. If you want to wear gloves and touch it, see how soft it is. Cotton. Pieces of cotton, if you can put them on the blood. Everyone is a bleeder today. And let's do that one. Sorry.
Okay, okay.
Done. Merci.
Okay.
No, wait. Just a massage and you're done. Can I have the mirror, please? Mirror. Yeah. Stay as you are. Hold the mirror. Check yourself. Can I have the mirror, please? Mirror. Yeah. Stay as you are. Hold the mirror. Check yourself. We wait until the blood goes away. We put some cream and we show the audience. This one I use 27 gauge. 27 gauge. You can use the 30 gauge. 32 gauge. Yeah, you can do for 32 gauge. I don't do proper Russian because already she has big lips. If I do Russian, it would be very lifted. Okay. And this I do in more advanced courses or different courses. You like? Now wait until it settles down. More Fusidin, my best friend. Oh. Thank you. Like I told you, you can touch and the product is very, 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 very soft. Can you go up, please?
Me?
Sit up. Yeah. There you go. Nice. So we basically did a lip lift. We flipped the upper lip. So this is the result with the M. You like it? Show your teeth.
Sorry.
Smile. Show your teeth. Okay. Not that sexy. And
It's numbed, yeah.
this is the profile. Very flat, yeah. And you can see. Very, 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 very soft, as if she's done nothing. And or two, they will look even so much better. This is very swollen. You like them? Okay.
A lot, yeah.
A lot? Good. Thank you. Okay.
Can I go?
Yes. Yeah. Let's put for you just Fusidin and she can go because she has a.
Some cotton stuff.
Yeah, I'll give you the gloves. Yeah,
Yeah.
that's it. We're done.
Thank you.
Thank you. Thank you, guys. Now, for the remaining candidates, if anybody would like to inject to have a feel of the product on the other side, I will do it now. Who wants to try the products? Yeah? Yeah. I'm done. I'm done with the workshop. Now you have to do it. Anybody wants to try? We're gonna do the 5 points for her. The 5 points. We're gonna avoid the fistones. We're gonna inject here where she has the ligament, and then we're gonna do superficial one. Okay? So we're gonna do a mixture, and we can prepare the mixture together. So we have a mixture of L, NHA, and DNA. L. Okay, give me 3 ml. Yes.
You tell us that L is XL is smoother.
Smoother, yeah.
And medium?
Huh?
Is smoother-
Medium?
is smoother
Medium
than
is thick. Less thick. So for younger
S?
looking. S under eye.
Okay.
It depends. Which one? See, sometimes I don't need to inject nasolabial because I treat the issue. But for her, I injected nasolabial. Okay. With the cannula, with the injection. Yeah. Now here I showed you but with the nasolabial fold, I do direct injection here, and then I fix the cheeks, I fix the jawline, I fix everything. Then I do direct injection on the bone. Then whatever is remaining, I do with cannula. Okay. Give me another 3 ml. Additional 3 ml. Yes, she has. Yes, she has. And I need connector, please. So as you can see, I'm preparing the product. Then I'm doing the connector, mixing the product. 32 gauge and I start, okay? Who wants to work? You're working? Okay. You're going to do. Who wants to work? You're working? Okay. You're going to do the 5 points and then the full face. Yellow hat. Okay, there you go. There you go. You got me the 3 ml? Yeah. I need connector, 3 ml. Merci. Anyone else to try the 3 ml? Either? 5 points first. So first.
How much is there?
3 ml.
One side.
One side. All yours. So let's prepare now for the other patient. We are going to do. And I want you to inject to prepare Amber Plus. Yes. one هذا القلم تفضلي. يلا. Can you withdraw also Amber 1 ml? Okay, so I'm gonna use for her this. يلا, I'm gonna wear my gloves. لا بدك تطلعي من النوز. You have to go from the nose. No, this is too far. So 1 centimeter, probably here. Okay. Then
you get
lateral. Yeah, lateral canthus. Go down to the maximum point of projection. Yes. Then. Yes.
2 centimeters.
And then in the jawline. Yes. And in the submental area. Bravo. Go the depth of the needle and inject. Push. Yeah. تقريبا يعني you can put 0.5 deep, very deep. Press more. خلاص done. As a piece of advice, always start from up. As a piece of advice, always start from up. Hold it up. Inject here, you will have the maximum lifting. Okay. Hold it up. Go in. Inject. That's it, yeah, on the bone. Same here. Up.
And
1 ml per injection. Okay. Now you can do here also. Lift the skin, inject, release the skin. It will stay in place. And it will stay in place. Same here. That's it. Don't put too much here because it will be more saggy. So here, go deep. Inject. خلاص. Remove. Now you can do the superficial. Who wants to do the superficial? Yeah? Yalla. Wear gloves. You want to do it like 2 shots by the way time she wears gloves? I will show you something. I will show you. So by the way, this is where I need a gloves with alcohol. Has the volume loss, and this is where she has the fistons. Don't get near the fistons whatsoever. So I'm gonna go underneath the and inject. See? Ta-ra-ra-ra. Okay? Again. We need the other one.
Don't you have an excess?
No, sorry. Okay? I'll show you also under eye. 1, 2, and 3. You can go superficial, you can go deep. This product will not stay in place. Then what I need you to do is points. Where is the white pen? If I want to draw in details my points of injection, it will be mainly lateral cheek. You lift the skin and you do the lower under the zygoma, and then lateral jawline, marionette, nasolabial folds. These are your points of injection. And if you want to inject them, you don't inject them these direct, you inject them the way you want to lift. So you want to lift, so you stand from there. Direct, you inject them the way you want to lift. So you want to lift, so you stand from there, and you inject, and you lift. Very superficial. Why would I use it if I want to have the patient have a lifting effect?
So if
I'm
we
not
start from
treating the
this,
skin, I'm giving the lifting effect. If I want to use the superficial, is going to be to actually target the skin alone. Yes. 1, 2, 3, 4, 5. 1. Press and bravo. 2. That's it, that's it. 2. 3. Mm-hmm. 4. And 5. Bravo. Here. No. No. This one? Yes. Because this is how you want your lift to happen, right?
So you put there, you want to lift.
Yeah. Yes. You put where you want to lift as if you're doing fillers. This is how I do my meso. I don't do it just normal. That's why you see lifting effects.
full face, you need 6.
Yeah.
3, 1.
Yes. See, she got the lift already because you're injecting the right way. Then you're going to do the nasolabial and marionette. Yes. 1, 2, 3. You have to put more. You have to give more. Put. Yes. Excellent. See? Then you have to do the jawline, also lift and inject. Lift and inject.
Here, here.
Yeah. So here like this and inject. And you finish off with the what do you call it? You finish off with the marionette. Honestly, have you ever made? Honestly, really, the combination is insane. That's why I like this product. Okay, that's it. Now you have to do. Yes, it will lift. Of course, she's doing the retrograde now. Yes, she's injecting and injecting and retracting. Bravo. What's your name?
Claudia.
From where?
From Poland.
Poland.
Yeah.
Okay. So see the lift? Insane. Alrighty. And even if you want to impress your patients, green head. If you want to impress your patients even more, you finish off with 1 layer of amber everywhere. This is instant lift. This is 1 ml. 1 ml of amber everywhere. So there you go. So this. Can I have gauze with alcohol? Thank you. Of course, don't forget to do the neck, the décolleté, inner arm, under inner arms, inner thighs. Here.
Which takes for the
Different. You can go with a cannula. They have a lot of lines so that you can do dissection, especially if they have damage from the sun. Can I have fusidin? You can do amber everywhere. You can do mix of amber DNA, NHA, just like we did with the yellow heads.
We need fantasy.
Huh?
We need fantasy.
What do you
Ja bym
think?
chciała trochę usta, mogę trochę usta?
Nie, bo pani ma już ustawione.
Aha, okej.
So,
A na dół tutaj na ustami.
She asked if she can put the filler into her lips, but I said
you have
no,
already
because-
old filler, yeah.
Yeah.
Okej.
So what do you think? See, this is only meso. Deal? I want to show you close the L filler effect. I think we have here. I want them to see the L, how it gives a very nice result when you put it direct injection. L, don't forget, please, don't forget L 25 gauge. Otherwise, it will not go. Okay. This one, it's not opening. I need your strong hands. Highest point of projection. 1, I lift, inject, and release. Take a look. It holds in place, it doesn't move. See? That's it. And we can do also here. Open. That's it. Can I change the head because it was on the lips? So I will use the same. We'll do now the lateral chin, and she's done. If it's not opening, wait. Okay, I have it. Okay, so lateral. She needs more work on the chin, yeah, but this is a good start. There you go. Much better, yeah? Good? Not bad. Yeah, let's have the cream and we're done. Thank you. You're done. No, stay. I need clean. Fuse it in.
Szkoda, że nie jestem facetem, mogłam mieć taką żonę.
What was that?
No.
She said that she wanted to have a wife like you.
Aww.
So that she is a woman, not a man.
Oh, thank you. I only heard shi. Okay, done.
No,
Merci beaucoup.
chyba się na kobiety przerzucę z tego wszystkiego.
And then we have our. I did for you half face. Ah, come. I forgot. So who wants to? Okay, of the amber always. It's your joker. DNA, amber, NHA. Do for the full face. Look how this is lifted, how this is down. Do the 5 points. After the 5 points, do the full face. Then finish off with 1 ml of amber everywhere. Okay? So come prepare us, please. Yeah, come prepare. So, okay. So you're gonna withdraw NHA, DNA, amber, right? With 18 gauge. Two. Okay. This you're gonna use for one side of the face for direct injection. Then this is for you. You can prepare 2 for superficial injection. One more. You can prepare 2 for superficial injection. One more thing. Who wants to prepare this? You're going to prepare the amber alone. All three, same products. Withdraw 1 ml. Yep. Oh, there you go. So one. Okay. It's okay. I can use the L. It's fine. It's okay. It's fine. And then the manage is fine. There you go. Close it. Then which needle you're gonna use? Thank you. Yellow head needle. There you go. Okay, because when you prepare it, you remember.
Yeah.
Okay, because when you prepare it, you remember. Yeah. Whomever prepared something is work with it. So, like a DNA. Eh? So 5 points. Okay.
Yeah.
So 1 ml. 1. Bravo. Okay. Now withdraw 1 ml from this. And 1 ml of my personal favorite, which is the amber. Okay. So you're gonna do the superficial ones.
Okay.
Okay? You're gonna do the deep ones, 5 points. You're gonna do the superficial ones, and you're gonna finish off with the one that you do everywhere, which is the 32 gauge. Okay. This is for them to leave your clinic with the 1 centimeter. هيدي last point. برافو. هيدي لا. هيدي انت هون وقت تحطيها على دروبي جاوز بتعمليهم اسوء للساد فيس هون. مليها هون على الساد فيس لانه هي she has a different anatomy. Everything has sagged down. Okay. Go. 32. 32, same as the deep.
Which one was this?
DNA, amber, and NHA. Yes, yes, withdraw. Push, 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 push. خلاص. Done. Other. Okay. This is a little bit too much. You just have to press again. Push, 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 push. Okay, perfecto. I think you're here. So what you have to do is if you have air, then did I just throw it on your shoes? Sorry. Okay. That's it. Bravo. See, now it's easier to inject. Come here. The rest you can put in the, what I did with the marionette is the C+, okay? And also this one. And you're doing here for the, you're doing a treatment for the patient for the cheeks, right? So you're gonna stand there. This is your direction and retrograde. Benefit from here. Okay, lift the and inject. Yes, excellent. Put more product. Put more product. Yeah, we are generous here. Yes, bravo. Here. Yes. لا هو in the clinic I really put this much. I really put this much in the clinic. I really put this much in the clinic. والله I want to have this treatment. This one. I want to have this treatment. This one with alcohol. Okay, this is more to the marionette. Okay, the marionette. Excellent. Okay, the marionette.
Like this?
Yes.
Like this
Yes.
or like this?
Don't go to special, huh? You have an artery there. That's it. Huh? See how it opened up?
Here one.
And then we have yours, which is going to be the cherry on top. Everywhere. Make sure you put also under eyes. Come. I want you to put it here. Remember the ligament I talked to you about? And the fistones where she has here. Fistones, those. This is where you're going to inject. Okay? 1, 2, 3. Bravo. Wait. Okay. Again, there's some air. So you have to push up the air. And then now you're going to start injecting. Be generous. Give more product. Yes. That's. You saw the difference? Now work on the nasal fold. Work on the marionette. That's it. It's enough because it's already marionette and then upper lip and you're done.
Upper lip here.
Mm-hmm. In the lines. Of course, I told you this patient, she needs a lot of treatments when it comes to the smoker lines. Superficial, we said. You remember when we talked about superior labial artery? Okay, it's deep, so you have to go superficial. Okay. Alrighty, maybe a tiny bit here. That's it. Merci beaucoup. Cream.
You do it so fast.
Yeah. Yeah. I learned to be fast in Dubai. Because when you see 30, 40 patients, you have to do full face lifting with threads. It takes me 4 minutes to do 40 patients. You have to do full face lifting with threads. It takes me 4 minutes to do full face lifting. Thank you. Merci. Thank you. Last victim. The birthday girl, right? Okay. All right. So birthday girl, we use for her. Who wants to prepare the mixture? Honestly, prepare the mix. It will help you. Mix of amber, aqua, and collagen. So we're gonna get one aqua booster from there. Yeah. The aqua booster comes in 1 ml. You're gonna add to it. You're gonna withdraw. Here you have 3 ml, right? So in the 3 ml, you are going to withdraw amber, amber, 1.5 amber. Add to it 1.5 DNA. Okay? 1.5, 1.5. How do you know which needle do you use? 18 gauge. So 1.5. Enjoy. Then where is the aqua booster? You have gloves on? Okay, so this is one with a connector. You put it inside. Sorry. Inside the other 3 ml. I need an empty 3 ml.
I can do.
Yeah. So, yeah. This is your connector. Put it inside the 3 ml. Okay. Close it. خلاص it's okay نشيلها هون. Okay. She's putting now the aqua booster there. What did you do? No. No. What? Give connector. No. We are mixing. So we are mixing. We put the 1 ml inside. So you have 1 ml of aqua booster, 1.5 DNA, 1.5 amber. Put it here, mix everything, and enjoy. Okay. And for her, I need the L with direct injection, please. L with direct injection. Just 1, 2, 3, 4. Yellow head and yellow head. Put yellow head, put yellow head. Enjoy. L direct injection and we're done. L. You took it? Remember L. You took it? Remember the L, which type of needle you use? 25 gauge, please. Okay, the orange one. So I will do the L because I want to show you the lifting effect. Then you can play as much as you want with these. Direct, somebody can do 5 points and somebody is going to do full face. Yeah. The girl, to give you extra care. Yeah, I'm waiting for you. Yeah. Again, so since I'm doing this, again, this is my ligament. This is where I lost the volume. 1, 2, 3, underneath it. Again. Along the line, 1, 2, 3. And I'm done. Then maximum point of projection. You can press on the blood. Then in the lateral cheeks. This blood duct holds in place, doesn't move. Okay? That's it. Thank you. See? Lifting. Straight lifting. Now she has here some marionette lines. Why? Because she has lost the deep fat in this compartment. So,
How much? How much did you put?
0.2. Lateral jawline. And you're done. I need another also L. Because we're going to do the chin. Then I leave you to do for her the 5 points. Yeah, you have. She doesn't match because we already did for her fillers. L, 25 gauge. Don't forget. Otherwise, you will call Anna and you tell her it's not going there. I figured it out. It's 25 gauge. 25 gauge. Yeah. Very easy. Now it's my favorite thing to use. So chin, 1, 2, 3. Volume loss. Blood. Chin, you know that you need a lot of work for the chin. Probably 4 or 5 ml over time, okay? And remove your hand, please. Let me see. Sorry. So she still has here more volume. Smile, relax. Smile, relax. 1, 2, 3. I go very deep to the level of the bone and I inject for the nasolabial fold. Done. Yeah, she's all yours for the 5 points and for the superficial injections. Excuse me? Who wants to do the 5 points? Yeah. Put the 5 points with it. Draw the 5 points first. It's easier. Yes. 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 Do that. This is, you are exactly at the foramen. You remember what I said? This is the medial part. Press here. You have pain and the foramen. Don't touch the foramen. So if you want to give her a nice lift, probably it will be in the nasolabial fold, in the fold, in the marionette line. Okay? Yeah, go ahead. No, all the way. Yes. Bravo. No, all the way. Yes. Bravo. All the way. Good. All the way. Who's gonna do the superficial? And all the way. Jump. Yes, perfect. The superficial one. Yeah. And all the way. Jump. Yes, perfect. Remember how I teach you how to inject? Lift the skin. Inject. Release. Lift the skin. Teach you how to inject. Lift the skin. Inject. Release. Lift the skin. Inject. Release. Yeah. Lift the skin. Inject. Rotate. Release. No. This is the same mixture as you have.
Oh, yeah.
Once you finish,
Yeah.
this is, remember, amber is what you want to send the patients home with.
Yeah. Okay.
It's the, how do you say, you put the primer, then you put the foundation, then you spray the
Right.
fixateur.
Setting is right.
أيوة. Bravo. We just need the fusidin and that's it. Wait, so because she has a little bit of volume more in one place than the others, so I'm just gonna give.
We can lift and can keep volume.
See?
Natural.
That's what I'm telling you. That's what I'm telling you. This is the lateral somatic because it's good. It will give us a nice lift, and you're done. Finished. Fusidin. You're gonna be here tomorrow for the body?
Yeah.
Really? Okay. The body is not so much theory. It's just few techniques of injections, and that's it. Merci. Thank you.
Thank you.
Thank you all.
Okay, one patient said that you have to finish her lips because you.
Yes, yes, yes. I have here the direct injection.
From this side.
So we're gonna use for her cannula, and that's it. Yes. Okay, relax your head.
What's this one? Back from this
To są na ty.
Yeah, I know. Point of entry. Then the cannula.
donkey.
I'm superficial. Okay. Then I go inside the lip and I give her a nice lifting effect. Okay. That's it. Beautiful. Give me direct injection. I'm begging for you. Give me direct injection. I'm begging for you. Nice lips. No, you remove the cannula and give me 27 gauge, the gray one. There's no need for this one. Yeah. 1 minute. Okay. So, can I have gauze? Thank you. Nice, huh? Tell her I made her lips bigger.
Where is that short?
M. Done. That's it. Okay. Thank you. Thank you. Now we clean and put Fusidin and she's done. We talked about Fusidin more than the Infini.
Tak powiedziałeś po jedną stronę.
Thank you. I'll give you my number. I'll write it down for you. No, you have to go like this.
Just one.
All right.
Just one.
Thank you. Thank you. Wait. You have blood. Wait. Blood. Thank you. All righty.
She's speaking
So,
much better
the blood. Thank you. All righty.
She's speaking
So,
much better
00, yeah, 971 507060 491. You can send me WhatsApp or you can call me. I have my phone that's on. Thank you. Welcome. Yeah, please. I get my phone. Paulina?
Ola. Ola, weź mikrofon od niej, to ci od razu go już da.
You like your lips?
Dobrze, mam podłączone, tylko tam kabelek muszę zmienić.